We turn now to some good news regarding the state's effort to try to help kids before mental health struggles end in suicide. There's a new report out just this week, and it shows the suicide rate for older teenagers in Colorado is dropping.
An encouraging data point, but just one data point in this long report that still paints a troubling landscape for kids' health and well-being in our state. 9 News reporter Jennifer Meckles joins us now with some context on these numbers and what this exactly means.
Yeah, it's hard to say good, right, when we're talking about this kind of stuff, but maybe encouraging is a better word. So this data comes from the 2023 Kids Count in Colorado report, put together every year by the Colorado Children's Campaign. They're tracking trends in education, health, well-being. Mental health is such a huge and complex issue in this state, and while youth suicide is just one component, it is a major priority for them. The data shows the teenage suicide rate has been rising and staying historically high since 2015. This is for kids between the age of 15 and 19. But something changed recently, a decline from 83 deaths in 2019 down to 56 last year. That's a drop of more than 30% over that 3-year period. Hopefully, that means more lives saved.
Until recently, we were seeing historically high levels of teen and youth suicide in Colorado, levels unlike anything the state had seen in a really long time. And so any little bit of progress is worth celebrating. And I think it's worth looking into what was behind that decrease so that we can make sure that we're keeping up the momentum in supporting our young people and their families so that we hopefully can keep celebrating declines in the future.
And yet not all the data is so encouraging. Between 2016 and 2021, the number of kids who went to the emergency room for a mental health-related emergency more than doubled. In that same time period, the number of kids who went to the ER for self-harm more than tripled. We're seeing the lowest suicide rates the past few years in many of our high country counties: Eagle, Garfield, Grand, Pitkin, and Summit. But the highest rates are in the southwestern corner. The same area, researchers say, struggle with higher child poverty rates.
I think that really speaks to the fact that we can't just look at solutions like increasing access to counselors or mental health professionals as the only answer. Those efforts are super important, but we also have to be more proactive in making sure that families can meet their basic needs and making sure that they have access to transportation and childcare and all of those things that help reduce family stress levels to a level where they can be mentally healthy.
So one last data point. I know I've thrown a lot at you here, but at the start of last school year, Colorado school districts had 278 vacant positions for things like school psychologists, school social workers, and counselors. And by the end of the year, almost 60% of those jobs were still unfilled. The hardest among those jobs to fill, guys, they found in small rural districts. Probably no surprise there.
So it's a tough job. Is that about money? Is that just about finding qualified people? I mean, I
think it's a little bit of both. I think it's a hard job to fill anyway. But here's interesting. They had better luck filling teachers in traditional educational roles than they did these mental health roles.
And that's still been
tough,
and that's been
too.
Hard. Yeah.
Right. Exactly.
So suicide, of course, becomes a hard number. But I think we're still at the very early stages of really getting data about mental health overall, especially with youngsters. That, this wasn't something people really charted 15, 20, 25 years ago. Hopefully these numbers do affect the way we do things and maybe make changes.
I hope so. The goal of this report, according to the people who put it together, is like, okay, let this be the basis for you to make policy. They also reference in this report COVID. COVID threw everything into some chaos.
And we haven't seen the long-term
Right. It's only been, what, a couple of years? So, but the whole point of these reports is so that people who make decisions can say, okay, here's the data. What can we do with this?
Yeah.
A lot to study, a lot to learn, hopefully get better. Thanks, Jenny.
Okay, thank you. And if you or someone you know is struggling with mental health, there is direct help available 24/7. Colorado Crisis Services has counselors available around the clock. You can call or text the number you see on the screen. You can also call the National Suicide and Crisis Lifeline at 988.